So we will wait for just 1 more minute, okay, and we will start after that. So first of all, I would like to give you an outline of what I am going to do today. So first we will be discussing the case scenarios, and along with the case scenarios, I will be discussing what all related topics or related content you have to read simultaneously in forensic medicine as well as in toxicology. Okay, so if you have a pen and paper, it will be good so that you can note down. But don't worry, at the end of the session, I will be uploading a handwritten PDF. Okay, I have made some writings on what all things I'm going to discuss today. I will upload that PDF in the group, so you can just brush through those topics while you are revising forensic medicine before your exam. Okay, so this is what I am planning. So first I will be discussing toxicology. Okay, is my audio everything clear? Okay, you are able to hear me properly, right? So if you have any issues, you can just put it in the chat box. Yes, can we go ahead? Okay, fine, thank you. So this is what I am planning to do. So already I have shared those case scenarios in the group. But now don't look the PDF, okay? Don't look see that PDF. I will be reciting the case scenario first. Then I will be going for the explanation. Will you upload this video? Yes, at the end of the session, it will be there in my channel. You can view it any number of times, okay? Don't worry. Yeah, why I'm discussing it live means it will be a bit more effective, and I also don't think that you will sit once again and another day and watch the whole video again. Okay, so just try your best to hear it completely today itself. Okay, fine. So maximum 1 hour. Okay, maximum 1 hour. So sharp by 8 I will wind up the session. Okay, just 60 minutes, but I will try my best in covering the maximum number of questions, maximum points and keywords. Okay, each case scenarios which I have uploaded in the group, I will be mentioning the keywords. Just keep those keywords or just note the keywords. Again, once again, I will be uploading this what content again in the group. Okay, so don't worry, but still, if you possible, you can just take note of these things. So the first question, let us go start from the question number 13. Okay, question number 13. So it is a question from toxicology. A 7-year-old girl is rushed to the casualty in an unconscious state as she has consumed and chops. On examination, you note the presence of meiosis and crackles on chest auscultation. She is hypotensive, pulse rate is 50, respiratory rate 36, ECG shows prolonged QT. So what is your diagnosis? Usually there will be a history of a farmer coming with a history of intake of insecticide. You will be thinking about organophosphorus poisoning. Why I have mentioned ant chalks means, remember, ant chalks are also made up of organophosphorus related compounds. Okay, that is why I mentioned ant chalks in the question rather than the common way of asking the insecticides or pesticides. So whatever it may be, remember this question, the answer is acute OPC poisoning, acute organophosphorus poisoning. So what are things you will write in a case of acute organophosphorus compound poisoning? You have to mention about the nicotinic effects of the OPCs, the muscarinic effects. Remember sludge. You know what is sludge stands for. Am I right? There will be hyperlacrimation, there will be diarrhea, there will be bradycardia, there will be hypotension. Okay, so all the secretions in our body will be increasing. And remember, you have to write separately what are the nicotinic manifestations and muscarinic manifestations. Why this is important? Because we have two drugs. One is atropine and another one is pralidoxime. Pralidoxime is an acetylcholinesterase enzyme activator, whereas atropine is an anti-muscarinic. So atropine will reverse only the muscarinic effects of OPCs. Okay. So we are giving atropine as the first drug because it will help you to overcome the sludge symptoms. Second is pralidoxime, which will help you to overcome the nicotinic symptoms, which are mainly the muscles. Okay, nicotinic what receptors of acetylcholine are located at the NMJ, neuromuscular junction, and at the neuromuscular junction, this paradoxin will go and prevent the overaction of this OPCs. Okay, so this is the important thing you have to remember. Do read about what is intermediate syndrome in OPC poisoning. Okay, intermediate syndrome in OPC poisoning. All these questions are asked multiple times in your university exam. So as I have told you already, sometimes there are very high chance of having a very tough paper this year, whether it is an SPM or FMT. Very tough paper. So we have to manage. So for that, I am mentioning these questions. Role of pralidoxime and atropine is important. Endrin. What is endrin? Endrin is also called as plant penicillin. Has been asked once in university. Plant penicillin is the other name of endrin, which is an organochlorine compound. There is only one treatment, that is supportive treatment. No role of atropine, no role of pralidoxime in treatment of endrin or plant penicillin poisoning. So first question we have discussed. 13. Question number, case scenario number 13 we have discussed. Remember, in toxicology, whatever topics you are reading, make sure you read something about the compound. Number one. Second thing, how it is observed, excreted, and metabolized in the body. Remember the mnemonic AEM. AEM. Absorption, excretion, metabolism. Third thing, if possible, try to remember the fatal doses, not necessarily. Third and the fourth thing, signs and symptoms. That is what we are learning through these case scenarios. Next, the postmortem findings. Postmortem findings, and the final is regarding the treatment. Here we will see atropine and pralidoxime. So these are the headings under which you should read toxicology. Read at least 2 or 3 points in each of these headings so that you can manage a short note. If it is an essay question, read 5 to 10 points. Okay, altogether have some 20 clinging points in each essay so that you can manage any poisoning questions in exam. And remember, I am expecting one question this year, that is Selfos. Remember, forensic medicine examiners are very fond of asking alternate names. We have very beautiful names like aluminum phosphate, zinc phosphate, which is we call it as a rodenticide, but the examiners won't like asking that question. Why? Because if they ask such questions, we will write answer, right? So they don't want us to get a pass mark. So that is the reason they are giving alternate names in forensic medicine. For example, once they asked Selfos as a short note. What is Selfos? It was an alternate name for aluminum phosphate. Aluminum phosphate, zinc phosphate, endrins or plant penicillin, OPCs, organochlorines, all those have similar clinical features. OPCs only we use atropine and pralidoxime. Rest all these poisoning, no treatment available, only supported treatment. So agriculture poisons we covered. Only chapter we have covered. Coming to the next question. Young women presents with headache. Okay. First question all done. First question, is it okay? Can I go for the next one? Okay. We will discuss it quick. Okay. So that we can finish within that 1 hour time. So anyone please respond. Is that okay? First question. Okay. Then coming to the next question. Young woman presents with headache and flu-like symptoms. Her symptoms begin after she installed a gasoline-powdered electrical generator inside her home. What is the most likely diagnosis in this patient? It is a case of carbon monoxide poisoning. It is a typical case of carbon monoxide poisoning. Remember, in carbon monoxide poisoning, remember what is the mechanism of action of carbon monoxide? It is electron transport chain inhibitor. Almost cyanide also has such a function. Okay, then it has more affinity to oxygen. You know the affinity of carboxyhemoglobin is around 240 times. Okay, this was an MCQ once. Okay, well, how much times? It is 240 times. And remember, and another one key word they will ask, what is carbon monoxide automatism? What do you mean by automatism? Because of some consumption of the substance, the patient will behave so violently. That means because when the blood level concentration of carbon monoxide start increasing over a period of time, the patient will behave as if he is some psychiatric patient. So on the postmortem, so post his death, while we are seeing the crime scene, people feel like, okay, it is not some suicide or it is not some carbon monoxide poisoning. It looks like some murder, some violent struggle has has been happened there at the crime scene. Okay, so you will get such a what thought. Why? Because the patient with carbon monoxide poisoning behaved like that, and that behavior is called as carbon monoxide automatism. Again, it was a previous year question. Remember, the characteristic post-mortem hypostasis you will see in carbon monoxide poisoning is cherry red. And another important thing, two important tests you have to remember in carbon monoxide poisoning. One is called Kunkel test, Kunkel. Don't worry, this the copy what I am saying, no, I will upload in the group. So don't worry about if you are confused about the spellings. Kunkel test and Hoppe-Seyler test, Hoppe, Hoppe and Kunkel. These are the two tests to detect the level of carbon monoxide in the body. Long-term exposure, there are a lot of people who are working in automobile factories. These automobile factories people on chronic exposure, they will develop Parkinsonism syndrome because carbon monoxide is going to affect the globus pallidus and putamen of the basal ganglia, leading to necrosis of the basal ganglia. That is why they can present as Parkinsonism. Remember, acute carbon monoxide poisoning is very fatal. The patient will die overnight. So in carbon monoxide poisoning, what are the things you have to remember? Its mechanism of action, what is carbon monoxide automatism, what is cherry red postmortem hypostasis, the two tests I have mentioned, long-term exposure, Parkinsonism syndrome. These are the clinchers. Okay, with these keywords, go and read your book. You will understand and rest what 5 to 10 points you just grasp. You can well manage an essay or short note based on carbon monoxide poisoning. And another must-known question, I have actually missed that in a case scenario, alcohol. Top to bottom read about alcohol. In that, one is Messivan sign, okay, or McEwen sign, whatever you pronounce. Second thing is alcohol gives nystagmus. Third thing, what is the legal limit? What are the punishments or medico-legal importance of what is that so-called as hit and drive? Okay, that is after drinking alcohol, no, we will make some accidents. So what are the IPCs which are related to that? What is the IPC? Earlier we have two IPCs. One is IPC 85 and IPC 86. IPC 85 is for involuntary intoxication. After that you are doing some crime. And IPC 86 is for voluntary intoxication. Simple. I am voluntarily drinking alcohol. I am going and doing a murder. This is IPC 86. Someone is mixing alcohol with my drink, Coca-Cola something. And in that inebriated condition, I am driving the vehicle, I made an accident and someone died. That is IPC 85. So 85 is involuntary, 86 is voluntary. Okay. Now BNS has changed, don't bother. 85, 86 IPCs is remember. Okay. So read top to bottom about alcohol. Then this year, and another potential question that you may not read, cyanide poisoning. One test, which is an MCQ, Lee-Jones test. We have Hoppe and Kunkel for carbon monoxide. Lee-Jones test is the test to detect cyanide. What are the stages of cyanide poisoning? Cyanide poisoning has same mechanism of action like carbon monoxide. It is going to cause histotoxic type of anemia. That is, it is going to be toxic to the tissues. That even though our blood has good oxygen amount, our tissues cannot take that oxygen. Why? Because the electron transport chain is being inhibited by cyanide. Okay, it is so called as hydrocyanic acid, HCN. Okay, so that's about question number 40. Question number 15. Autopsy done in a case of poisoning reveals leather bottle appearance of the stomach. Leather bottle appearance of the stomach. Always think about one poisoning, that is phenol poisoning. Remember, you will study phenol. The examiner will ask you another name. Why? I told you, they don't want you to get good marks. So they will ask in another alternate name, that is carbolic acid. Carbolic acid is the other name for phenol. Number 1. Second point, postmortem appearance shows leathery mucosa. Test ferric chloride test. Like we have Kunkel, Hoppe for carbon monoxide, Lee-Jones for cyanide. We have ferric chloride test to detect carbolic acid. Why I am stressing these points alone means these points are asked in your previous exams. So this time also they may even repeat. So for that I am stressing it. Then remember, what are the rest of the things you have to remember in carbolic acid poisoning? Study about ochronosis. That is, this phenol gets deposited in the intervertebral disc, giving some hyperpigmentation in the vertebra. That is called ochronosis. Then what do you mean by phenol marasmus? Phenol marasmus. And next is this carbolic acid poisoning is going to produce something called as a green colored urine, and that is what we call it as carboluria. Okay, what is it called? Carboluria, green colored urine. So phenol marasmus, carboluria, ferric chloride test. Remember, in exam also, the examiner will expect these keywords only. The examiner don't have time to read all the stories that you are writing. If you write these keywords and just put it in a box and highlight it, okay, definitely the examiner knows that you have read something about phenol poison. Okay, yes. Then, what are the questions I am expecting come in relation to carbolic acid poisoning? Number one is aqua fortis. What is aqua fortis? It is the other name for nitric acid. Nitric acid has a very peculiar feature. When it comes in contact with the skin turns yellow because of the formation of picrate. Okay, so that is called aqua fortis, or what, HNO3, nitric acid other name. We have another compound which is called as the king of the chemicals, H2SO4, that is sulfuric acid. Other name is oil of vitriol. All these alternative names has been asked once. You will study about sulfuric acid poisoning, but in the exam, the question paper, when you see oil of vitriol, you will be thinking, oh, what is oil of vitriol? I have studied sulfuric acid, nitric acid, hydrochloric acid, oxalic acid, but I don't know what is oil of vitriol. It is other name for sulfuric acid. Aqua fortis is the other name for nitric acid. And salt of sorrel. What is salt of sorrel? That is oxalic acid. Do read about oxalic acid, do read about oil of vitriol, do read about aqua fortis. Carbolic acid hints I have told you. When I upload the PDF, you can just refer that. Okay. So 3 questions done. Yes, quick. 3 questions done. Yes. Yes, please respond quickly. Okay. Next, question number 16. A person present to the emergency department with dehydration, weakness, multiple episodes of watery diarrhea and non-bilious vomiting, garlic odor breath, QT prolongation. What is your diagnosis? This is a clinical picture. If this question was asked in your microbiology exam, you will write that is cholera. Unfortunately, they are asking this question in forensic medicine, so you can't write cholera. So what answer you are going to write? Acute arsenic poisoning. Why I say it is acute? Because acute arsenic poisoning mimics like watery cholera. Yeah, very good. Arsenic. Acute arsenic poisoning mimics like watery cholera. Okay. It has garlic odor breath. It has garlic odor breath. I forgot to mention one point. In OPC poisoning, you will be getting kerosene-like odor. Okay, kerosene-like odor is seen in OPC poisoning. Garlic odor, of course. See, these odors are actually seen interchangeably in many conditions. Okay, some book says even in garlic odor is seen in OPC poisoning, but based on Reddy, which is a standard textbook, I am just making these statements. Okay, so kerosene-like odor, OPCs. Garlic-like odor means go for acute arsenic poisoning. What are the points? Okay, get ready, be concentrated, be focused. I'm going to say some salient clingers on arsenic poisoning. Number 1, we have 2 types of arsenic poisoning. One is called fulminant. I am consuming 1 bottle of arsenic as such. I will die within few minutes. That is fulminant poisoning. Second thing is gastroenteric type. Someone is mixing arsenic. That is acute arsenic, gastroenteric type. Okay, I am getting these cholera episodes. Third thing, over a period of time, daily, some 1 mg, I am taking over 1 year. That is called chronic arsenic poisoning. You would have studied something called as Mees line, which are transverse white bands on the nails. Rain drop pigmentation on the skin. These 2 features are seen in chronic poisoning. 1 MCQ, definitely. Which of the following is not seen in acute arsenic poisoning? Your answer should be Mees line. It is seen only in chronic arsenic poisoning. So we have fulminant type, we have gastroenteric type. Leather bottle appearance or leathery mucosa of the stomach is seen in carbolic acid poisoning. Red velvet type appearance of the mucosa of the stomach is a characteristic feature of acute arsenic poisoning. Each word is very clear. That is why I am stressing those words. Okay. So acute arsenic poisoning, you will get velvet stomach. That is the post-mortem appearance. Read about Mees line, raindrop pigmentation. Remember, arsenic. It is a type of metallic poisoning. It has an ability to delay putrefaction. What do you mean by delay putrefaction? Or it means it delays the decomposition of dead bodies. It can be detected in the hair, nail, even in the skin for years and decades. A patient who died of acute arsenic poisoning in 1990s Now I am doing exhumation. I'm digging the graveyard and I'm just taking the bones or something. I'm giving for forensic analysis. Now also I can detect the presence of arsenic. That is a very merit or an advantage of arsenic. Fine. So these are the important points you have to remember in arsenic poisoning. What is the treatment of arsenic poison? It is DMSA, succimer we call it as. DMSA, other name is succimer. Okay, there are many treatment for arsenic poisoning. Just remember one, DMSA, which is the standard treatment for arsenic poisoning. Question number 17, a history of bluefin tuna ingestion. Following that, memory loss, insomnia, cause tremors. This is almost similar to Minamata disease. M for M, Minamata for mercury. In Japan, in Minamata Bay, which is a place, the residents have a habit of taking bluefin tuna, which are present in this seas, which are contaminated by organic mercury. Remember, we have different forms of mercury. Mercury vapors are there, okay? Mercuric oxide is there. In that, organic mercury is the most toxic form of mercury. And these fish which are living in the seas will consume this mercury. Once we consume those fishes, what will happen? We will get mercury poisoning. What is the other name of mercury? It is called as quicksilver. What is the treatment of mercury poisoning? It is BAL, British anti-lewisite. For arsenic, I say it is DMSA or succimer. Here it is BAL, British anti-lewisite. Remember, organic mercury is more toxic. Yes. Now, I'm going to say some important points about acute mercury poisoning versus chronic mercury poisoning. Just clinches. First, in acute mercury poisoning, we will get something called as, in the postmortem appearance, okay, we will have something called as coagulation and necrosis of the stomach mucosa. Liver will show fatty change. Liver will show fatty change. In acute mercury poisoning, we have something called as acrodynia, so called as pink disease, which is a generalized rash present all over the body, which is nothing else but a type of hypersensitivity reaction on exposure to mercury or mercury vapors. So skin, no, in contact with the atmosphere, mercury vapors will be there. There will be a idiosyncratic reaction or a hypersensitivity reaction which is going to cause this acrodynia or pink disease. In the question, they have mentioned memory loss, orofacial numbness, cause tremors. All these are features of chronic mercury poisoning. So what are the features of clinchers you have to mention in chronic mercury poisoning? Danbury tremors. It is nothing else but a type of tremors. It is a type of a cause tremors. Second thing is called as mercurial erythism. This has been a previous year question. So when they ask about mercurial erythism, indirectly in a short note with just what is mercurial erythism? It is nothing else but the psychosis and depression which is seen in mercury poisoning patients. You can't write a short note with just these 2 points, right? So indirectly you have to write the mercury poisoning. So when they but the thing is, you have to identify, okay, erythism means it is seen in mercury poisoning. It is for that I am stressing those points. So erythism, think about psychosis and depression which occurs in mercury poisoning patients, that to chronic mercury poisoning. And we have something called as mercurial lens. In the lens of the eye, the mercury will undergo deposition. So Danbury tremors, mercurial erythism, mercurial lens, postmortem shows coagulation and necrosis, liver show fatty change, organic mercury more toxic, treatment is BAL, acrodynia or pink disease is a hypersensitivity reaction on exposure to mercury vapors. So these are the clinchers in case of mercury poisoning. Then next question, complaints of eating paint, lead poisoning. Lead poisoning is also called as plumbism. It is also called as saturnism. Why I am stressing this point again is because these alternate names are being asked many times in the exam. Plumbism or saturnism. Plumbism or saturnism. Saturnism or saturnine gout. You would have studied in pathology, gout is because of increased levels of uric acid in the body. But because of increased levels of lead in our body, it will also produces the pain in the first metatarsophalangeal joint. But here it is not because of uric acid, it is because of the lead. That is why we call it as saturnine gout or plumbism gout. Fine. What is the mechanism of action of lead? It is going to inhibit our heme synthesis pathway. It inhibits the ALA dehydratase enzyme. It will also inhibit our ferrochelatase enzyme. These two enzymes are being inhibited by lead, that is responsible for causing anemia. That is why in lead poisoning, what is the earliest change in MCQ? What is it? I think in MMC, in internal exams, they have asked this question. Earliest change in lead poisoning is pallor. What do you mean by pallor? Yeah, that is the what the clinical sign you elicit in an anemic patient is what we call it as pallor. Okay, yes. Second thing, so pallor in the eyes. I'm just going to say the clinchers, not everything. Then gums, you will see Burtonian lines, bluish gums. On peripheral smear, you will have studied in pathology basophilic stippling. Sideroblastic anemia. Lead poisoning is one of the acquired cause. Usually sideroblastic anemia will be hereditary. Here, lead poisoning is an acquired cause of sideroblastic anemia. Okay. How? Ingestion. Paint. Intake history. Always think about lead poisoning. Treatment. Mercury, lead, same treatment, ball. In lead, we will use one more agent called as calcium EDTA, ethylene diamine tetracetic acid, EDTA, calcium EDTA. If you can't remember, don't worry, remember ball for mercury and ball for lead poison. What question I am expecting this year? Once in supplementary exam in forensic medicine, they ask about chalcosis. What is chalcosis? Copper poisoning. Remember, copper poisoning also causes normochromic, normocytic type of anemia. It also produce free radicals like what is lead iron poison. No, all those produces free radicals, and these free radicals are responsible for the tissue damage. So chalcosis means it is other alternate name for what? Copper poisoning. Copper poisoning. So can we go for the next question? Can we go for the next question? Yes, please. Took already it's half an hour. Okay, so the next question is dry mouth, urinary retention, constipation after consuming an unknown substance, pupils are dilated. This is characteristic, this is just opposite of what? OPC poisoning. Okay, that is so called as datura or atropine poisoning. Atropine is a delirium poison. In that question, they have mentioned it's an unknown poison. Why? Because it is called as road poison. Because it is usually seen on the highways and roads. It is also called as deadly nightshade. Datura stramonium, we see. Datura stramonium is also called as deadly nightshade, road poison. Okay, it produces pupillary dilatation. Remember 8 Ds: dry mouth, dementia, delirium. We have 8 Ds. Remember the 8 Ds. It produces mydriasis, pupillary dilatation. It is a delirium poison. It is also used as a stupefying poison. That means we will, on highways and all, there are a lot of what? Robberies, theft, everything. For that, they will use this datura plant, okay, and they will do a robbery. So that is why it is also used as a stupefying agent, road poison, deadly nightshade. Postmortem appearance is similar to asphyxia. That means in asphyxial death, there will be congestion, okay, petechial hemorrhages, okay, ecchymosis. All these things you can mention in the postmortem appearance of internal organs in case of atropine poison. Then corn pickers pupil. The pupillary dilatation is characteristically called as corn pickers pupil. Okay, what are extra questions related to atropine they can ask? One is run amok or a motivational syndrome. Both are caused by cannabis sativa. Okay, ganja, hashish, karas. Okay, all these comes under cannabis sativa. Please read about cannabis, run amok, a motivational syndrome once asked. Another question which was asked was from cocaine, what is formication, so called as Magnum syndrome? Patients who are having the habit of what cocaine addicts know, they will feel that some insects are crawling under their skin, even though it is actually a type of hallucination. Okay, cocaine formication, also called as Magnum syndrome. Okay, that is cocaine addicts. We will see that. And do read about speedballs. What are speedballs? What are alternate names of cocaine? What are the alternate names of cocaine? Please do read about. And do read about LSD, lysergic acid diethylamide. Do read about MDMA, methyldiamine methamphetamine. Okay. MDMA is wide known. I won't forget that. What is MDMA? Why? Because my college every year there will be an event. We call it as ecstasy. Okay, it's a cultural event. The name we have given for the cultural event in our college, we call it as ecstasy. Ecstasy is nothing else but methyldiamine methamphetamine. Okay, it is a hallucinogenic drug. Okay, yes. LSD, lysergic acid diethylamide, MDMA, also called as ecstasy. Okay, do read about cocaine formication, amotivational syndrome, or run amok. Do read about Nux vomica. Nux vomica, it is a spinal poison. Once in university exam, they don't give these two names. They give it as Kuchila. Kuchila. Kuchila is the native name for, it is a common name. Okay, it's a tribal name for Nux vomica. Strychnos nux vomica. Strychnine, spinal poison, Kuchila poisoning. Do read about Corneum maculatum, so called as hemlock. These things you will forget to read. That is why I am stressing it again and again and again. Because without, if you don't read anything about this, you can't even write anything about these questions. So that is the reason I am stressing these questions again and again. If you read OPC, you can write endrin, you can read aluminum phosphate, zinc phosphate. It is not like this. You have to read about strychnine poisoning. Then only you can write something. Coming to the next question. Male coming to the OPD with increased heart rate and palpitation on examination, episodic tachycardia and occasional extrasystole with visual field defect. Characteristic of a type of common poisoning, almost everybody is using this, that is nicotine. It is nicotine poisoning. Nicotiana tabacum. Nicotiana tabacum. It is a cardiac poisoning. Digitalis purpura, foxglove, cardiac poison. Aconite, cardiac poison. Nux vomica, corneum maculatum all are spinal poisoning. Whereas nicotine, digitalis, aconite all are cardiac poisoning. From this, any one question they are going to ask. Very rarely students read these topics, so only I am saying this again. Nicotine, either smoking or ingestion, tobacco leaves, chewing tobacco leaves. They are going to block the autonomic ganglia. That is the reason they produce bradycardia, respiratory depression, angina, and extrasystole. What is extrasystole in the sense? There will be ectopic heartbeats. Usually, the impulse should come from what? SA node, then AV node, atria, ventricle. You have a pathway, right? Here, even though the SA node is not firing, the ventricle will start contracting. That is called as extrasystole or ventricular ectopic beat, we say. And tobacco has high toxicity towards optic nerve, optic neuritis, optic nerve damage it will cause. That is the reason for visual field defect. Visual field defect. Do read about aconite poisoning. Aconite, common name they asked, Methasahir. It is seen in Himalayan mountains. All parts of the plants are poisonous. The root of the aconite resembles like house radish. All parts are poisonous. It is also called as monk's hood. It is a very beautiful bluish plant, okay, bluish flower. It is a cardiac poisoning, cardiac depressant, bradycardia, hypotension, all will occur. It produces a characteristic finding in our eyes that is called as hippus. Once they asked hippus as a short note. Hippus means they are indirectly asking you to write about Methasahir or monk's hood or aconite poisoning, which is a cardiac poisoning. Alternate contraction and dilatation, alternate constriction and dilatation of the pupil is what we call it as hippus, classically seen in aconite poisoning. Treatment, atropine. We can even do gastric lavage. Final question, question number 21. You all know it is snake bite. Snake bite is a very vast topic, but I am telling you, just remember these things. see the differences between poisonous and non-poisonous snakes, which will be given in the form of tables. Number one. Number two, we have different categories of snakes. One is called the Viperida, which includes the saw-scaled viper, Russell's viper, okay, which are hemotoxic type of snakes. That means which causes more bleeding. Second is called as Crotalidae. In Crotalidae, we have the rattlesnake. Third thing is Elapidae, in which we have the cobra, kite, all those things. And finally is sea snakes, which are myotoxic. Cobra all are neurotoxic. So just see this. Just see the differences between poisonous and non-poisonous snakes. Then we have an important test. This has been an MCQ. Which test will use to diagnose the case of snake bite? That is 20-minute clotting test, blood clotting test. When you go to your hospital IMCU, intensive medical care unit, when a patient comes with a history of unknown bite, they won't say whether it is snake or something else. It may be even an insect also. But we will immediately take blood. We will put it in a vial and we will leave it undisturbed for some 20 minutes, and we will see at the end of 20 minutes whether the blood is clotting or not. At the end of 20 minutes, if the blood is clotting, means he is perfectly normal. If the blood does not clot even after 20 minutes, we will again repeat the test, and we without any delay. If the blood doesn't clot even after some 40 or 45 minutes, we will immediately start what we call it as polyvalent ASV, anti-snake venom. It has been manufactured by the Hopkins Institute in Mumbai. What are the snakes against which the polyvalent anti-snake venom is effective? Number one, common cobra. Number two, common krait. Number three, Russell's viper. Number four, saw-scaled viper. MCQ, which snake is not covered under anti-snake venom? It is king cobra. Okay, king, he is the king, so we can't defeat him. Once he bites, death ensues. Okay, so anti-snake venom, common cobra, common krait, Russell's viper, and saw-scaled viper. Do read about what are the first aid measures in case of snake bite. Do read about scorpion sting. Scorpion sting, a very characteristic clinical feature is hypertension, very high hypertension. The patients, when I was in PhD during my internship, one patient comes with a history of scorpion bite. Okay, so I measured his BP. His BP was 240/120. 240/120. We immediately give a tablet called prazosin. Immediately give a tablet called prazosin. So that this prazosin is almost like a autonomic ganglion blockade. It will immediately bring down the blood pressure, and we will refer to higher centers. Okay, that is Iowa Medical College. So till all toxicology question, is it okay? All toxicology question, is it okay? Yes. Can I get a response from your side? Yes. Okay. Then a doctor decided, question number one, doctor decided to inform his patient's wife that her husband is suffering from syphilis. The above action is an exception to what ethical responsibility, and elaborate the doctor's action. Normally, doctors has to follow something called as professional secrecy. We should not reveal the details of the patients without his or her permission. But at some specific cases, for example, in case of this here, okay, that is the husband is having syphilis, so it is the doctor's responsibility to inform his wife that he is having some sexually transmitted diseases. In case of murder attempts, in case of, for example, 4 years back, one student come from Wuhan. Yes, she had symptoms of COVID. The first treating doctor, should he inform that to the public health authority, or can he hide? Okay, just a cough and cold, it's not COVID. Imagine? No, he can't. So there are some 8 conditions which are mentioned in your forensic textbook, in which are an exception to professional secrecy, and which is what we call it as privileged communication. So in view or taking into account the safety of the the community, or taking into account about or in response to a law, for example, the court will order you to reveal the details of the patient. So we have some 8 exceptions. In such cases, doctor should reveal the details. So this is an exception to professional secrecy. And what is the doctor now doing? That is called as privileged communication. Do read professional secrecy and privileged communication. Second question, a drunken doctor on emergency operated a patient. Unfortunately, he cut an artery and the patient collapses. So here comes the question of negligence and malpractice. Professional negligence is otherwise called as malpractice. Do study the difference between the civil negligence and criminal negligence. What is res ipsa loquitur? It means thing speaks for itself. I am doing a surgery. I forget a scissor. I just keep it within the abdomen, sutured. After some days, the patient comes with complaint. I take an X-ray. Okay, from some hospital, he took an X-ray. He found that scissor is within it. He's going to file a case against me in the court. I should not. There is no need for the patient to prove that I had done wrong. Why? Because in the X-ray, scissor is within his abdomen. Who is the only person who do surgery and forget the scissor inside? Doctor. So the thing speaks for itself. The patient need not prove. In case of civil negligence, it is the duty of the patient to prove that I am wrong. In case of criminal negligence, it is my duty to prove that I haven't done any mistakes. So that is res ipsa loquitur. What do you mean by novus actus interveniens? I am not just responsible for my actions alone, I am also responsible for the consequences, the logical consequences of my actions. Do read about what is novus actus interveniens. Third thing, contributory negligence. That means I have prescribed the patient, I have prescribed the drugs to the patient. The patient is not taking the antihypertensive medication. One day he presents with a stroke. Who is responsible? The patient is also responsible. Okay, I am telling the patient, okay, but I am not giving the proper instructions. I am not giving the proper instruction, but I have prescribed the drugs. I am not saying, okay, in what time you have to done. But the patient also don't take the drugs. He comes with a stroke or myocardial infarction. So here doctor as well as patient is also responsible for this. It is called as contributory negligence. Remember, contributory negligence is not a defense mechanism in criminal negligence. We can't say that the patient is responsible in case of, okay, I have just, as in this case scenario, I have cut an after the patient collapsed. I can't say, right, the patient is also responsible for that. So contributory negligence is not a means of defense in criminal negligence. What are the defense in criminal negligence? What is res judicata? What do you mean by res indicata? Please read what is res judicata and res indicata from your textbook. Res judicata means J for judiciary. Remember, one person, I have done something wrong. My patient has filed a case in the district court in my state. Okay, and it is I'm having the trial for that. He can't file simultaneously the case against me in the High Court or Supreme Court. And the district court has punished me. Okay, I have to pay some 10 lakhs. I paid the 10 lakhs to the patient. The patient can't file the same case in some other court, in the High Court or Supreme Court, saying that I have done wrong, the doctor has done wrong, I need more money. He can't do that. That is called as res judicata. Second thing is res indicata. That means within 2 years of the crime, the patient has to file a case. I have done something wrong. After 10 years, the patient is coming that, okay, in 1990s, the patient, my doctor who was treating me has done something wrong. I want the compensation. No, he can't do that. Within 2 years, that is called as res indicata. Then read about what is vicarious liability. That is, an employer is not just responsible for his own action, he is also responsible for his employee's action. That is called as vicarious liability. Do read about therapeutic misadventure. What do you mean by therapeutic misadventure? I studied from a good college. I have proper skills. I have tried my best in saving the patient, but something which is out of my hands, which is beyond my control, has happened. Because of that, the patient died. That is called therapeutic misadventure. For example, usually antibiotics have hypersensitivity reactions, vaccines have hypersensitivity reactions, so we will give a test dose before giving the main dose. I have given test dose of penicillin. Penicillin is a drug which is having highest rate of hypersensitivity. Anaphylaxis. I have given test dose to the patient. Okay, he don't show any reactions, so I have given the main dose. Unfortunately, in the main dose, the patient collapsed. Patient died. I can't be held guilty because Test dose is normal. That is the reason why I administered the main dose. So I am not responsible for that. It is beyond my control. Something has happened. That is why the patient died. So this is called therapeutic misadventure. And question number 3 and 4 are the two questions you are going to get, which is based on your recent CBME pattern. That is age determination based on the ossification centers. Actually, this is a long case for you in your practical exam. Do watch. I have already made a video on age determinations of bones, and based on that, how you can find the age of the patient. Please watch that video. There are a lot of values and numbers you have to by heart. No other way. Just watch it or read it multiple times. Based on that, you will be asked to find the age of the patient, and you will be asked to write about the medico-legal importance of that particular age group. That means there are certain things that an above 18-year-old person can do in India. Above 16 years can do in India. Okay, 12 years can do in India. 7 years. So each age has some certain medico-legal importance. Please see that again. What in that video I have discussed about the medico-legal importance of the age. Do read about Gustafson's criteria. Okay, do read about Gustafson's criteria, and yeah, that's it. And coming to question 5, we have different ways of dissection in autopsy. Either we will do en masse dissection, organ by organ dissection, okay, that is Gons technique, Virchow's technique, Latule's technique, okay, and we have something called as Rokitansky technique. Here the question, in HIV positive patient, what type of dissection you will do? It is Rokitansky technique. Rokitansky technique means this is actually the type of dissection that we have been using the most during the COVID time, because COVID is an infectious disease. So the forensic surgeons have to do in situ dissection. In situ dissection means at that within that organ itself they have to do dissect and they have to take the sample. That is called Rokitansky way of dissection, so called as in situ dissection. What do you mean by virtopsy? Virtopsy is other name for virtual autopsy. In India, the premier institute for virtual autopsy is All India Institute of Medical Sciences, New Delhi. They have the Institute of Virtual Autopsy there. Okay, that is using CT and MRI. The whole body is being scanned and the cause of death is being analyzed using the help of artificial intelligence and some other softwares. So that is called as virtual autopsy using the help of CT and MRI machine. I have already made a video about what is obscure autopsy, what is negative autopsy, what is sudden death. Please watch it. Again, very important question. What is psychological autopsy? That means psychological autopsy means it's not like doing autopsy on a psychologically abnormal person. It is finding the psychological reason behind the cause of the death. Okay, it is not even after postmortem I am not able to find any cause of the death, and okay, I'm feeling something fishy, and I'm just going to see, okay, how is his family background, how every people has behaved to it. So the psychological reasons behind that I am going to see. That is actually called as a psychological autopsy. Then a patient was brought to autopsy, purplish red discoloration on the dependent part of the body. Yes, here comes the question of post-mortem hypostasis. I'm going to say some other alternative names for post-mortem hypostasis. It is post-mortem hypostasis is also called as liver mortis. It is also called as bibisus. It is also called as suggulation. It is also called as post-mortem staining. All these names multiple times in multiple exams they have asked it. Okay. The problem is at that time when they ask you about, okay, write a short note on liver mortis, you will get confused. Write a short note on bibisus, you will get confused. Remember, these are nothing else but alternate names for post-mortem hypostasis. Do read about cadaveric spasm, rigor mortis, early, intermediate, and late changes of death. Post-mortem cooling, that is called as algor mortis. Okay, please do read this topic. What is the procedure for embalming? One supplementary exam they asked this question. What is the procedure for embalming? It is given in your textbook. Just read that. Then adipose hair, mummification, all are very common questions. Then yes, 8, 9, 10, 11, 12. Yeah, in that I will like to mention about 8, that is electric shock injury. Okay, that is while bathing he touches the switches with wet hand and he died. So that is the question of thermal injuries. In thermal injuries, do read about hypothermia, do read about burns versus scald, do read about antemortem versus postmortem burns. Okay, the different patterns of electrical injuries, and of course do read about asphyxial death. Asphyxial death, any question can be asked as an essay. Strangulation, throttling, judicial hanging, typical and atypical hanging, okay, freshwater and seawater drowning, then yeah, all those can be asked. And again, coming into what, rape. what is the definition of rape, punishment of rape, examination of the victim in rape, examination of accused in rape, seminal fluid analysis, okay, blood stains analysis. All those are very potential question. Last year essay question was forensic psychiatry, mental health care act. Okay, again I have made a video about forensic psychiatry. Make sure if you watch that itself, you can write an essay on that. What are the what amendments made in MTP Act 2022, Medical Termination of Pregnancy 2022. Again, I have made a video on that. Do watch it. Don't write 1971 Act. It is outdated. We are following currently MTP 2022 Act. Okay, and yes, see, question number 10. On external examination, the forensic examiner found that he was holding grass in his right hand. So, antemortem drowning, one of the very salient feature is cadaveric spasm. Cadaveric spasm is one of the important signs of antemortem drowning. Remember, do read about the medico-legal importance of diatoms. What is Jetler's test? This Jetler's test is used to differentiate between freshwater and seawater drowning. Do read about antemortem and postmortem drowning. Okay, all those things. Then, yes, seminal fluid analysis. Do read about sodomy and examination. Okay, that do read about sodomy and examination of the what persons involved in sodomy. Okay, sodomy and the examination of the patients involved in sodomy, and what are natural, unnatural sexual offenses, that is rape, adultery, incest. What are sexual perversions, what are sex linked offenses. We have a lot of what that is masochism, sadism, lesbianism. Lot of names are there. Those names are very frequently asked in your Viva exam also. Please go through all those things. What are sex linked offenses, what are sexual perversions. Okay, please make sure you are reading this. Okay, you will only read rape, okay, because you will ignore the other topics, but these other topics also they are asking the short notes these years. Then what are the methods of criminal abortion? Fetus autopsy, fetal autopsy, that is at each age, 3 months what are the findings in a baby, 6 months what are the findings in a baby. So do read about the fetal autopsy and fetal changes. In that we are having the Morrison's law and the rule of Hussey. Okay, rule of Hussey and rule of Morrison used for age determination of the fetus. Do read about that. Then okay, forensic psychiatry and mental health care act, I have already told you. Grievous hurt, grievous hurt. What are the conditions in which we can say that hurt is grievous? We have some different clauses, that is permanent loss of eyesight, permanent loss of hearing, permanent privation of any member of the joint. Okay, so like that we have different clauses. Do read about grievous hurt. It is again a possible essay question. Okay, it has not been asked previously as an essay. Okay, this year sometimes they can ask you a case scenario and they will ask whether it is a grievous hurt or not. Do read the 6 to 8 clauses are there, subdivisions are there as per the Constitution of India in your textbook. Just read those subdivisions so that you will understand in the case scenario whether it is grievous hurt or not. Then yeah, time since death, I have already told you the changes: immediate changes, early changes, and late changes. Fine. Okay, so I think with that we have come to the end of the session. Yes. So can we wind this session? Please respond. Do read the topics that I have mentioned multiple times. Either you will skip these topics or what you won't read routinely, but I am stressing that again and again because these are very, very important. Okay, so can we wind up this? If you have any doubt, this video will be there in my channel. You can watch it again also, no problem. Very soon I will be uploading the written material. That means the what all thing I have what discussed today. I will upload that PDF. I have already made the PDF. Just I will share it in the group now itself. Okay, I will end this session and I will share it in the group. Fine. Okay. So thank you. So thank you so much for attending today's session. Prepare well. All the best for your exam. Okay, if possible, I will do a similar session for SPM also. Okay, if possible. I'm not promising, but I will try to do, because SPM is very vast. Okay, there's no beginning and no end, but I will try to do that.